So I would like to take you forward about why do we have to consider about happiness, that is a subjective part of a subjective indicator, and how are we connecting this with our physical activity and social connectivity and cognition. Yes. So before we go into the major focus of the talk, I would like to highlight why is it a concern to all of us? Because population aging is a global phenomenon, and India also is aging in the same or faster speed in connection to the global phenomenon. So, with the 143 million population of aging 60 years and above in India currently, so that is more than 10% of the population. It is almost reaching to the 12% in the recent statistics. The major question comes when we are talking about that the longevity is very predominantly noticed across all countries, many countries and all countries across the globe, and India also is moving much faster in aging population. So, although it is a point of celebration for the nations to say that because of the scientific healthcare advancements and pharmaceutical positive addressing of the health challenges, people are able to live longer. So, although it reflects the national celebration, considering it is a positive advancement, the aging doesn't come alone, it comes along with challenges. So, having said that, aging comes along with the challenges, are we prepared for addressing all the challenges? Are the challenges are some of the challenges are unpredicted challenges comes along with the aging. When we say aging is not essentially to be coming along with the crippling and all the disabilities. There are positive aging, successful aging, and healthy aging. It majorly, although it depends on our biology and senescence, it majorly also depends on our social determinants of health, health determinants, as well as our lifestyle behaviors. So, having said this, when these challenges are the nations, are we prepared to age healthy and to age in independent and dignified manner? When I said aging comes along with the challenges, we have plenty of challenges. Let's focus on, for example, when communicable diseases challenges is still not addressed, non-communicable disease challenges growing much faster. The data shows that 43% of the people are with non-communicable diseases. And to say about the loneliness is growing a pandemic, shadowing pandemic across all ages and specifically to older population. And the recent data shows older people are experiencing more and more loneliness and social isolation because of fastly growing family and social dynamics. So India is known to be a country of with the traditional belief system and socio-cultural tie-up of family system, and family system we call as Kutumba Vyavastha in India. So it is very stronger, and Globe used to look at the India for the indicating or giving an example exemplifying about the family system strength on population health and well-being. However, in the recent urbanization, modernization, and various social phenomenon, the social dynamics have witnessed the fast family dynamics too, where the people are living more and more nucleified and nuclear families number is increasing, joint family system is almost reducing or vanishing. So although all ages are experiencing loneliness because of this impact, moreover, the senior adults in the family system are mostly experiencing loneliness, social isolation, which is a triggering factor to the depression and early dementias. So here, when we are talking about WHO and United Nations Decade of Healthy Aging is emphasizing on healthy aging. Healthy aging is a process. It majorly when it says functional ability all have 5 dimensions according to WHO's definition itself. So functional ability being able to have your physical functions intact, you are able to move around independently, you are able to connect with the society, you are able to fulfill your activities of daily living and other accessory instrumental activities of daily living, retains and protects your sense of self-esteem and a sense of coherence. So that makes you feel satisfied and the purpose in life. So when a person suddenly have decreased functional capacities, you confined to a bed and not able to move around, depend on somebody else to take care of your activities of daily living, it grossly impacts your mental health. So that is where the functional health is very closely connected with your mental health, and also mental health is a pretty close having interlinked with your cognitive neuronal function. So depression, persistent and chronic depression triggers degenerative process and is one of the triggering and predisposer to the early dementias. So here in our recent study also we tried to look into the perceived happiness, because happiness itself is a subjective and a robust predictor for the subjective well-being of the people. And across the globe now, subjective well-being is gaining attention because what objectively we will see homeostasis is not deranged. However, the person may feel less energetic and unhappy. So that is why subjective well-being is gaining attention. Individual subjective well-being helps the individual to be more engaged with the self as well as with the society and preserve the social connections, thus maintain the mental and cognitive health, because the life satisfaction and sense of fulfillment is very important. Even WHO defines that the subjective well-being indicates these parameters. Promoting healthy aging amidst of social transitions is very challenging. So, however, being a public health faculty and being public health researcher, we try to focus on healthy aging. Our healthy aging initiative in our school continues in various components and dimensions. We have empowered social connections and cognitive stimulation exercises, multi-domain interventions in communities. So having the low resource settings, focusing and enriching the primary care system is very strongest element for cost effective interventions to move our the path towards the healthy aging. With that motive and concept, our research aim towards connecting the rural and urban population in our healthy aging research. So subjective well-being and happiness are very self-reported, but however, it reflects the individual life satisfaction, purpose, and the physical activity is very closely connected. When you are happy, you tend to be energetic and you are motivated, because though biologically we have interconnection of hormonal influence and we call them corticals, even happy hormones, physical activity stimulates to have your dopamine and serotonin and also the estrogen are activated, which makes you to feel a sense of fulfillment. And the socially associated, having a connections and networking is another important point to address the loneliness and isolation. And to preserve the cognitive reserves, and physical exercise as well as the social connectivity also are important. When even the studies shows that socially isolated people, the interleukin 6 enzyme clearly shows how the social isolation is connected with your biological derangement. Some of the evidence references, including our recent study, shows higher happiness and subjective well-being is correlated with more physical activity behaviors and socially being connected. And physical activity and social connectivity are very closely associated, and which are also again interlinked with the better cognitive outcomes. So we try to look into the behavioral modifications, whether it is stress buffering and whether it is helping the cognitive reserves is even our study looks. So with the evidence, we identified that there are several studies focusing on single element like physical activity or on social interventions. The randomized control trials are very limited, and the studies focusing on multi-domains in the low and middle income countries, especially in the public health perspectives, are very limited. Here we have to consider the geographical as well as the cultural context. So India itself is having a diverse population with diverse socio-cultural backgrounds. However, we have to consider all these things when we have healthy aging population, and India also has the highest target of addressing the sustainable development goals through healthy aging and well-being. So integrating these public health interventions into primary care, into aged care services, early identification of loneliness, and promoting the happiness and subjective well-being and cognitive reserves and physical functions is very essential. So this is what, in consideration to this, our research study has taken into interconnections of physical activity, cognition, functional health, and social connectivity with perceived happiness in rural adults. So, although we are including the urban population and rural population, this current study, what I'm going to sharing with you, is majorly focused on the rural population. So we try to examine the association of happiness with physical activity and cognition and social connectivity, and functional health. And for physical activity, we have used, along with the IPAQ, International Physical Activity Questionnaire, we also have used functional health parameters. So all this very comprehensive, robust, and standardized functional health parameters have helped us to assess the functional health in adults. The uniqueness of our study is we have included starting from middle aged adults, because healthy aging doesn't start only after the 60s. So we try to include our population from the middle age from 40 years, and we have included up to 90 years of age. And we have used Montreal Cognitive Assessment for cognitive assessment, and we have used Oxford Happiness Scale, and also we have developed our own scale to understand the other their social capital and social support system and social connectivity and social network, including the Duke Social Support Index also. So though we have used very comprehensive and holistic assessment to understand happiness, to understand functional health, and measuring the physical activity behaviors and cognition and their social connectivity behaviors, and also we try to look into what is favorable for them, what factors are enabling them to be socially connected, and what are the barriers for them to be socially connected. Because from 40 years to 90 years, so far, immediately, even in India or any other countries, when we think of rural population, we feel that comparative to the urban, rural population are more cohesive socially, and the social cohesion is comparatively better, and they are connected. But surprisingly, our studies indicating our rural population are also moving towards more and more digitalized, and because of the changing social dynamics, they are also becoming more and more less socially cohesive, and more in social isolation on loneliness also is recorded during our findings. This is one eye-opening findings we have found, but which is also very close, consistent to some of the recent data in different countries, especially in Asian countries too. So, so the studies in primary data and the community-based studies in low-resource settings is very essential to understand the changing aging, not only aging demographics, but also dynamics of health and well-being in aging population, starting from not just middle adults. We also proposed to start this studying of these parameters starting from young adulthood, and currently our ongoing research is trying to focus on starting from young adulthood, though the current research which I am sharing is focusing only from the middle adulthood. So 270 participants have participated in our current study, and it is more completely this 270 population covered from out of 8 villages of a particular mandal. We have randomly chosen 4 villages, and we have covered the population of 270 who are meeting our population criteria and who are also willing to participate in the research study, because the robust mechanism of comprehensive and holistic assessment of this takes several visits to the community, and population acceptance and their patients also is very essential and challenging. So, however, we have very cooperative 270 participants participated throughout. And even after completing this research study, other villages people and community leaders are even inquiring and requesting us to continue this study for other villages and population. And majority of them have got benefited out of our exercise intervention program also. So these are some glimpses of our assessment in the communities. So, as I have mentioned, public health system, grassroots health workers are very essential backbone to the public health system and primary care system. We have also involved the primary healthcare workers like ASHAs, ward members, ANMs from Indian primary care system. We have ASHAs and ANMs. Those are representative from the communities, and they are more acceptable, and they are very closely connected people with the community. To gain the confidence and acceptance, initially we have used ASHAs, though since almost more than 12 years we are very closely connected with this communities and public health outreach. So the grassroots workers are very closely connected with our every research project. They are assisting us and mobilizing the participants and keeping them motivated, which is very essential for any research to get successfully conducted. And we have age criteria when we have used 40 to 90 years. Above 80 years, we do not have any participants. We have participants from 40 to 80 years, and we have included both men and women. We did not had any transgender population in our research study, and we have not no recruited population in transgender. And the happiness when is in front of you when you see it, and not at all happy, somewhat happy, and not particularly happy and moderately happy. You have numbers, but pretty happy, very much happy, and highly happy. There are no participants at all. And when you see this data, and there is an association with happiness when you see the demographic variables with the age. And also those who are, it is not that those who are highly educated are happy. And in our study, we identified that those who are with not even having a formal education are more self-actualizing. They are very prepared and adapted to the changes in the aging. So they are adapted to the changing environment in the family as well as the society, and they are moving forward with a very much positive approach. And however, in the study, we also identified those who are married are better in the happiness, and the economic status also are showing positive association with happiness. And coming to the happiness with physical activity, with the cognition, with social support associations, and we have used the correlation analysis of these parameters interconnections, and you can see that these parameters interconnections are showing, especially This is very closely connected. The significant connection is associated with happiness and physical activity, and also happiness with cognition. So these two things, so you can see here, and it is significantly associated with happiness with physical activity, and also happiness with cognition. Though there is no significant association identified with the social Duke social support scales. However, it showed with happiness with physical activity and mild the cognitive functions. And coming to here, when you see the significance of this functional health, also, so mobility and also the balance, and also about the lower body strength and coordination, these parameters of functional health, when you see it is endurance, mobility, lower body strength, and also the balance. And to measure these parameters, we have used these assessments, and almost all of them have shown very significant association with subjective well-being, that is in particular the happiness. So with this, I would like to highlight saying that how do you feel? How satisfied are you? How happy are you? Is a very positive, a very strong indicator for your energy levels, vitality. And this is very closely indicated through our study findings and exploration of this interrelationship between happiness, physical activity, cognition, and social connectivity, especially with all the parameters of functional health, showed that there is a progressive degradation of health and social well-being when the people are less happy or lonely. So when people are lonely, you don't even feel like going out for a walking. You don't even feel like saying a hello or talk to the other people. So this may increases the incidence of depression, as well as it is interlinked with the neurodegenerative stimulation. Neurodegenerative process is enhanced, and the people early dementias are very predominantly seen with people with chronic depression and chronic loneliness. So whenever the aging population are increasing more and more in numbers, and are we prepared to age with dignity? Healthy aging is very essential for focusing on public health interventions where the physical activity, some of the review meta-analysis and systematic reviews have shown a bidirectional associations between happiness and physical activity with the cognition. And as well as evidence also is supporting that social connectivity has a very positive association with the cognitive health. And also happiness is a robust predictor for the entire psychological well-being and also promoting the cognitive research and cognitive health. So with this, our public health interventions, especially focusing on primary care interventions, strengthening the primary care, the affordable and the interventions which can be implemented in the low resource setting and cost effective interventions are very essential to reach out the population of various socio-economic backgrounds, especially for early identification at the primary care level. So exercise programs, especially multi-component exercise programs, along with the social engagement and also including the psychological and cognitive stimulant exercise elements is very essential. These multi-domain and multi-component interventions are essential for active, cognitive, and healthy aging. So our program, our intervention, what we have developed in our aging lab has a combination of these multi-components, and specifically we have focused from middle-aged adults to older-aged adults until even 80 years of age. Participants have given very positive feedback, and they have also showed this pre and post intervention, which I could not present in your share with you present today's talk, but our pre post interventions have shown very positive and very motivating and very encouraging results, and which we have published, and we are also drafting the other papers in connection to our other findings from the study. So these positive link connecting the subjective well-being is very essential to connect with the other physical health and cognitive health parameters, because even we have in India has a beautifully designed national program for healthcare of elderly, and which covers all these components. Even 2010, when it is launched, it covers beautifully all these components. But because of highest populated country with the limited resources, social care resources as well as the healthcare resources, this has become still an implementation challenge in countries like India. So, although it is a challenge, it is very essential to focus on these preventive public health interventions in primary care and public health care system to strengthen and to promote healthy aging process. Because the primary care play a major role in early identification of not only the functional declines, because functional declines goes with the risk of fall and injuries. So fall risk also is connected with the disabilities, morbidities, and early mortality, and also functional fall risk related injuries results into confinement to the indoors and confinement to the home, and increases the loneliness and social isolation. So, which requires preventive and social prescribing programs. Having said it is a public health, and healthy aging and longevity programs should not be a single element or single discipline programs. It should be interdisciplinary, multidisciplinary programs. When a cognitive scientist and a public health as well as a neuroscientist, even including the clinicians, joins hands, including the physiotherapist, a multidisciplinary approach is more promising for preventing and public health programs across the globe, and specifically in India. We are looking at this very promising and sustainable approach for healthy aging. Community engagement activities are very essential with multi-component approach, because public health is the backbone of the healthcare, and public health strengthening is very essential to strengthen the health and well-being, promote the population health. So in our aging lab, our PhD scholars are focusing on various components in aging. One of the PhD scholar focuses on nutritional intervention, another PhD research on physical exercise intervention, and reminiscence, that is a psychosocial intervention combining reminiscence also is one of the intervention. And we are also working on the chronic pain interlinked with the sleep quality as well as the cognition and mental health. So these are the glimpses of our healthy aging lab in our school, and we are trying to look into the age-sensitive gait training program. We also have cognitive assessment and also body composition assessment to check the nutritional parameters, also in varied age groups. We have very close and positive community engagement. We include the grassroots workers as well as the community leaders in our programs. Thank you. As aging is a celebration, it is a challenge also, but accepting it, adapting it, aligning with the changes is very essential to engage with the self, to engage with the society, and which makes to age with dignity. Aging with dignity is very essential. By aging, we are not losing the years, we are adding life to our years. And inside every of us, we have a child we have to nurture, and adding life to each day, each moment is what we are going to age successfully. Thank you. I will be happy to answer any questions.